Shalini Bharadwaj. You all are watching ITV Networks Medically Speaking. In our last episode, we discussed about pregnancy and COVID-19, and today we are going to discuss about tuberculosis. We have with us on our panel Mr. DALBIR Singh, who is the president of Global Coalition Against Tuberculosis, Dr. Raghuram Rao, who is a Deputy Additional Director General Tuberculosis and Public Health Specialist, Government of India under Ministry of Health and Family Welfare. We have with us Dr. VIJAY, who is an Associate Professor, Pulmonology Medicine at All India Institute of Medical Sciences. Welcome to our panel, sir.
Thank you.
So we have to discuss, sir, today we are going to discuss about tuberculosis as we have World Tuberculosis Day also. Mr. DALBIR Singh, sir, I wanted to discuss first think that, what kind of health policies we have in India for tuberculosis patients.
Look, I have always maintained that policy is very fundamental to everything else that follows subsequently. Okay, it should be at the core of everything. It's like a foundation. And I set up this forum years ago, almost a decade ago, in 2012. And to tell you very frankly, then we had what was prevalent in terms of diagnostic serological tests, and which, as per WHO, were absolutely outmoded and not even 10% accurate. And believe you me, I was driven by a passion at a very personal level because I suffered tuberculosis not just once, 2 times. I came from the jaws of death. And I took upon myself the cudgels of setting up a foundation.
That means you can feel the pain of tuberculosis patients.
Yes, I not just pain, the agony. At least the second time, my treatment went up for almost 18 months. I nearly lost my life. And this was, and to tell you, well, subsequently maybe we'll discuss it. I got it from a man who used to drive my car. Okay, as a Nepalese driver, he had TB, and he would go on coughing, and I told him he wouldn't listen to me. But I got the infection from him. But I suffered 2 times over. Maybe some lapse first time, I don't know. I was treated at Apollo, still that lapse took place. And what I'm saying is why policy is important. Now, we had those tests banned in 2012. I still remember, I had a tough time. I used to go to Ghulam Nabi Azad, he used to be health minister. But I also come from political background. I had access to him. And in 2012, we had those tests banned. We had.
Sir, are you talking about TB gold test?
Pardon?
TB gold test, sir, you are talking about?
Yes, today the world has moved on in 8-9 years. We used to have we have been advocating for gene expert machine. There was no gene expert machine. We went to Barcelona, and our honorable health minister was with me that time, and we insisted. This was 7-8 years ago, and then we set about getting gene expert, the molecular diagnostic machine, which are CVNAT, and of course another version of that is TrueNAT. We have incorporated. But there were not many things that have happened at policy. You're coming to policy. This is just one thing. We didn't have any research consorting for TB. We had that established. So there's a lot of sustained advocacy for 8 to 9 years. I began with 4 members of parliament. Today, I have 36 members of parliament on my board, cutting across party line. They only talk TB. No ideology, no party line. Just TB. Because TB in every constituency of India, in every nook and corner of this country. Today, we lose 1,500 people every day. It's almost 3 times the figure than the peak figure of even COVID. And if we do not catch TB today, and we are in for serious trouble. Something that has troubled the planet for nearly 9,000 years. And in these last two centuries, we lost millions of people to TB. Okay, 1 billion people have died in last 2,000 years on this planet. The bacteria that was discovered 9,000 years ago in Egypt, I was going through the history. We have already lost 1 billion people. And there are a number of factors in India too, where, of course, as the debate develops, maybe I can contribute more on it. We have to take everyone on board today. Dr. Rao will also have Central TB Division done a remarkable job. RNTCP has done phenomenal work in the last few years. Is possibly and arguably the biggest anti-TB project in the world. RNTCP and now, of course, National TB Elimination Program, they have treated more than nearly 15 million people. It's not a small figure. But our problem is we have 1.3 billion people and a burgeoning population. And there are a number of social, economic, political factors which come into play. We have vast amount of population living in rural India. And the problem is how to get these people to come and get the diagnosis done. How to put the entire, because at best, the government
Awareness is
outreach,
important, sir.
because sarkar, no matter how much infrastructure you create, there are always shortcomings. See, because we have 650,000 villages in this country. The rural belt, how do you reach every man? How do you active case finding? And if you find them, how do you get them to reach the diagnostics? And even if they get the diagnostic done, how do you ensure that you don't break the treatment? Like when this COVID took place, with all the lockdowns at the regional level, state level, and the central level, for months together, where there was this dislocation, breaking the treatment adherence, people couldn't get medicine could not be delivered their doorstep. And even at the best of times when there are no lockdowns, you'll be surprised, even in public sector, 1/3 of total people who seek care, they drop out. They don't take till they're totally cured. And when it comes to private sector is a very vague sort of a definition. What is private sector? There is a guy who's not even a qualified MBBS doctor in a village. There is a guy. It is kind of a unregulated, fragmented sort of a sector. Okay, where people are treated in private sector in this country, and that's the fundamental problem. So we have to get down to integrate the private sector very effectively with the government sector. And we made an attempt 6 years ago with support of the government. I started a pilot project in Patna. Okay, Mehsana, and then we took it to Maharashtra. We have taken it to many districts of India. Today, based on that model, Jeet's model with Government of India and even Global Fund, they're doing a similar thing, public-private interface. It is very necessary, and I have told the minister 5 years ago, we have to refine that model for each one of the states, because each state has its own characteristics. And we have to work out a model. Unless we engage the private sector productively, we cannot end this disease. Because we all have, not only that, and I'm very happy that Harshvardhan in the last National TB Forum meeting said that I want every stakeholder, I want every partner, strategic, non-strategic, I want everyone who can play a part in this great endeavor to end TB. And 2025 was a deadline because the Prime Minister has given statement in the floor of Parliament. I was in the United Nations with Mr. Nadda. In the UN General Assembly, statement has given on behalf of the government that 2025 India will end TB. 5 years before the Sustainable Development Goals deadline of 2030. And yes, government has the will today. Government has the will. We have the resources. Okay, because I have seen we did a lot of advocacy to increase it, because 14 to 17 there was paucity of funds. Now 17 to 20, government released $1.8 billion. That's a hell of a lot of money. And everything is in order. We have strong political will. We have a strategic vision. We have a wonderful national strategic plan. We can take us through. But what we need to do now to integrate the private sector, we must utilize the local governments. India has 250,000 local governments, okay, as a result of 73rd and 74th Amendment. We have panchayats from district, even in the village and at the block level, all over India. Okay, we have 3.2 million people who are elected every 5 years. They are legally constituted, legally mandated. We can use them. Let's integrate these panchayats. Let us also use the communities. What has been our shortcoming? We have not engaged the community effectively. And when we engage the community and civil society, we should engage them at par. We have to give them respect. We have to create a legal framework, an administrative framework, and tell them you are our partners. You are not subordinate to us. Okay? Because without community engagement deeply, also we would not be able to reach our targets.
Yes, because of course, sir. Community engagement is important. We have with us Dr. RAGHURAM Rao also. Sir, in 2017, government declared that they are going to eliminate tuberculosis by 2025. How TB can be eliminated, sir, if we talk about, we are in 2021, how it can be eliminated from India by 2025? How much we are prepared to do?
Yeah. So When we first did this, national strategic plan, which Dr. Dalbir was mentioning about, this was made in 2017, when we actually decided that we will make an attempt to achieve the SDGs for tuberculosis, the global targets, 5 years ahead of 2030. So the baseline in 2015, was that as per the WHO estimates, it is 217 cases, are there per lakh population. That was the estimate. And the latest WHO report says that in India now we have 193 per lakh population, as an estimate. So that has reduced, by significantly a reduction has happened. And to match with that is the coverage that we are doing under the program. So in 2017 we were almost losing a million cases, which was not getting reported. Almost 10 lakh cases were not getting reported, and now that gap has dropped to less than 2 lakhs. So we have an estimate of around 26 lakh TB cases, and we are notifying around 24 lakh TB cases. So once we find every TB case and we put them on the right treatment, the transmission to the next person doesn't happen, and we are able to break that chain of transmissions. That is the agenda with which we are pushing ourselves, and a lot of effort has been put in terms of man, material, money. All the infrastructure that is required has been put in place. Molecular diagnostics has been scaled up. Gene expert, we have an indigenous TrueNet machine now that is available in every district of the country. The newer drugs that came in, bedaquiline, delaminide, is available across every district in this country. So we are going full blown in terms of pushing and trying to find every TB case and achieve our goals. To couple this up, what we are also doing is integrating this into the health and wellness centers under the Ayushman Bharat program. So what happens is that every sub-center in this country, it is at a population of around 5,000 at the village level. So in these centers we are decentralizing TB services to be able to provide services at that population level, at 5,000 level, and the community health officer that would be there manning that sub-center would be in charge of making sure that TB in that population is controlled. So the plan for TB is integrated with the plan for Ayushman Bharat. So the scale up that will happen in the health and wellness centers, we are seeing that by 2022 we would be saturating, and almost every sub-center in this country would be converted to health and wellness centers, and a comprehensive primary healthcare service would be provided, and taking TB in sync with that. So that's the goal with which we are confident that we will achieve our 2025 targets.
Dr. Vijay, is TB common in India?
Oh, Shalini, this I think both of the previous speaker has given a clear-cut answer. TB is still a MINAC, and it is affecting almost 4.5 million people per year. It's almost taking a life of almost 1,500 patients per day. So you can imagine how common it is. No disease in the history is taking too much life because of single disease. So you can imagine how common is tuberculosis. Even being a physician, even at AIIMS, all this tertiary care center, and whenever a patient comes with any respiratory symptoms, let us say cough or fever or anything, so first differential we always keep is a tuberculosis. We always think that there is high possibility that this patient can have tuberculosis. So such the impact or that TB is having even on doctors. So coming back to your question, yes, tuberculosis is very common and can present in any kind of form. Maybe pulmonary tuberculosis, which is getting more attention because of reason behind it, because it can spread very fast, and also it is one form of tuberculosis which can take life also. But as a pulmonologist or as a physician, we come across many other type of tuberculosis. Let us say extrapulmonary tuberculosis. For example, many patients who are coming with lymph node tuberculosis, bone tuberculosis, even abdominal tuberculosis. So almost every physician, irrespective of their subspecialty, maybe pulmonologist, maybe general physician, maybe surgeons, maybe gastroenterologist, maybe neurologist, every subspecialty is managing these patients. And I'm saying it again, tuberculosis is one of the commonest disease responsible for a significant number of loss of life, disability, as well as significant consumption of the resources in our country.
Sir, as you said, we have many types of tuberculosis. All of them are curable.
Yeah, I think I will explain further. Tuberculosis in general is a curable disease. In general, why I'm saying, because most of the patients, they will be having a tuberculosis due to drug sensitive mycobacteria. Mycobacteria is the organism which cause the tuberculosis. Okay, so most of the patient, they will suffer with a drug sensitive tuberculosis, meaning thereby if we treat with a effective regimen, majority of patients, at least 80% of patients will be cured in first attempt. And in the other, let us say 15 to 20% of patients, there may be resistant to one drug or other drug, but still there will be major patient, they will be responding to tuberculosis. Then there is another group of patients where you will find a drug resistance tuberculosis. The resistance can be to a single drug, it can be to more than one drug, and sometimes multiple drugs also. So depending on that, we say that this patient is having either drug sensitive tuberculosis or monodrug resistant tuberculosis or multi-drug resistant tuberculosis.
Sir,
and sometimes
drug resistance TB exactly? What exactly it is?
So whenever there is a resistance to a particular drug, so to define drug resistant tuberculosis, any drug if resistance, then we say drug resistance. But to say multi-drug resistance, then patients should have the resistance against rifampicin and INS. At least these two drugs should show some evidence of resistance. Then we say that this patient is having multi-drug resistance. Then there is another group where we say that even rifampicin is not working, isoniazid is not working. Then there are some injectable drugs, the drugs which are given as injections, they are also not working. Then they are grouped into XDR. So based on that, we can divide these patients in at least 3 groups. And then there are subgroups also like pre-XDR. I'm not going more into technicalities of these terms, but to make it simplify, the mycobacteria can show resistance to single drug, more than single drug, and multiple drugs. So based on that, we can divide it. It is important because if patient is having drug sensitive tuberculosis, chances of cure are very, very high. But if patient is having drug resistant tuberculosis, then chances of getting cure is lesser. And there comes the role of physician. If we do not diagnose timely which patient is suffering with drug resistant tuberculosis, which patient is suffering from multi-drug resistant tuberculosis, which patient is suffering from XDR tuberculosis, if we do not pick up at time, then chances of cure is less, and there are chances of deaths are very, very high. And another important aspect of this same is, if we don't cure these patients or don't catch hold of these patients, they will spread the same disease in the community also, and from one person to another. And then you can imagine that how many patients will be contacted tuberculosis from that particular patient. So it's very, very important for a physician to make a right diagnosis at the right time and prescribe a right drug.
Sir, one more important question I wanted to know, because it is related to social stigma also, that these all tuberculosis are spreadable, means all are communicable, or the lung tuberculosis is the only one which is communicable?
Oh, very, very important question. I think there are 2 aspects you asked. One is the social stigma. Yes, it is still in 21st century. It is still a stigma. And I have many patients which are coming to my OPD, the young girls who are having extrapulmonary tuberculosis, and their mother will be concerned. We are planning marriage of the daughter, and we don't want to disclose this to the would-be in-laws. So, and there will be wives, they will not tell to the husband. And if husband and wife both are knowing, they will not divulge the diagnosis to their in-laws. So still it is considered as a big, big stigma. coming to the second part, sorry, can you repeat the question? I forgot that.
The second
So,
question is, sir, is it communicable? All the types of tuberculosis are communicable, because most of the people think that, if a person is going through the tuberculosis, that he or she must be, it can be communicable to others. That means others, other people who interact with that particular patient can also get tuberculosis. So these all are communicable or not? Only lung tuberculosis is communicable?
yes, that is also very important to understand. See, as I told, tuberculosis can involve any part of the body. But a good thing is, other than pulmonary tuberculosis, pulmonary means lung tuberculosis, other diseases are usually do not spread to other patient. So the usual mode of communication means from one person to another person. If TB spread, it spread by droplet infection. So the patient who is having pulmonary tuberculosis, they keep on coughing, and they will cough the pathogen also in the sputum, and they will spread to the other person. So if somebody is having pulmonary tuberculosis, that also a sputum positive, microbiologically proven tuberculosis are more chances of spread as compared to, sometimes there will be tuberculosis, but when we test the sputum, it will not show any mycobacteria. There is tuberculosis, that kind of also, but that is less spreadable to others, means chances of spread to other person will be less when sputum is negative. But if sputum is positive, these patients are very contagious, and then they can spread the disease like anything. But other tuberculosis, just I told lymph node tuberculosis, for example, that kind of tuberculosis usually do not spread to others. Similarly, the bone tuberculosis or maybe abdominal tuberculosis, these usually do not spread to others.
That means we don't have, awareness in our society. Dr. Raghuram Rao, sir, my next question to you, that, why the testing has been reduced during COVID-19?
Yeah, what happened, one is that, during the COVID-19, we had to control COVID. So there were a lot of, public health measures that the states and districts had to take in terms of trying to reduce the interaction in the population, reduce, so lockdowns were put up, the public facilities, transports were stopped, and people were, the movement of people were restricted. The mall, shopping malls, hospitals, everything was shut, for lockdown, so that we could break the chain of transmission. So that was required for COVID. So what happened in this, because of this scenario, many other non-COVID illnesses, including TB, people could not come to the hospital to, seek care. People could not go to the private sector also, because even that was, shut down. So that was the challenge with, especially during the lockdown period. But post-lockdown, a lot of unlocking happened in a phased manner, and so the testings improved. But during the month of April, we had the maximum impact of COVID when the full national lockdown was in place. But yes, there were a lot of mitigation measures that were taken in terms of trying to help people access healthcare. So a lot of telemedicine was used, where people could online consult with doctors, and or all the call centers were used, where people can contact. Then somebody could go to the house and collect samples, or if somebody was already on treatment, then the health worker could go to the house and give the remaining medicine, so that the treatment was not discontinued. So all those extra efforts were taken, and in the post lockdown scenarios. So a lot of mitigation, but yes, there was almost a 25% reduction in the diagnosis of tuberculosis because of COVID restrictions and all. Globally, that was impacted. In India, yes, considering the population and the extent to which COVID, that had spread in our country, it was more so in certain specific states where we had a larger impact of COVID, in Maharashtra, Tamil Nadu, Andhra, and all. But slowly, of course, every nook and corner of our country got involved with COVID, and restrictions had to be put in place.
Dr. Hadda, sir, my question to you, that the symptoms of COVID-19 and tuberculosis are same?
See, it's very interesting question, but let me make it clear that both diseases can present with same symptom initially. Means both disease will have cough, both will have fever, both can have other respiratory symptoms also. But there is a huge difference between these two diseases, because usually tuberculosis present as like not a sudden onset. It's usually a slow kind of a disease, and initially patient will keep on ignoring these symptoms. There will be mild cough kind of thing, mild fever, weight loss, loss of appetite. So these symptoms are not very severe as compared to COVID, which will suddenly start and patient will have symptoms. So someone can confuse, but once initial that 5-7 days or let us say 2 weeks are passed, after that two diseases separate. There is a clear-cut separation that this is not tuberculosis and this is tuberculosis. Most of patient will come with a little bit longer period of illness, usually in at least few weeks, if not days. So definitely it's a difference at presentation also.
Dr. Dalbir Singh, my next question to you, sir, how local government can be helpful to eliminate especially tuberculosis by 2025? How they can be useful?
Shalini, because it's only to for Jan Andolan, we need to muster every ounce of energy, and we need to build strong alliances. And very fortunately for India, India has nearly 250,000 elected local governments, what we call the panchayats at various levels, I explained to you earlier. And since the government does not have that kind of outreach, okay, they're done phenomenally well. I mean, there is no doubt we've done remarkably well in terms of our anti-TB program. But the world over now, it is felt, particularly after COVID experience, it is felt. And globally, look, I'm telling you globally what is happening. People are investing a lot of money in changing the nature of systems, health systems. They are decentralizing health system, because that is the ultimate mantra. You have to decentralize. You see, because, and particularly in large democracies, large population like India, 1.3 billion people, you have to take healthcare to the people. See, because like in olden time, our sub-centers, primary centers were mostly referral. There was nothing actually happening in terms of giving healthcare. So we have to get out of that mold. And for doing that, people are the world over now, they're investing in health system, a lot of money to make it more decentralized. So the healthcare reaches your doorstep. Drugs are reach your doorstep. And now we have technology. We can use ICT to monitor to treatment adherence, even for testing. All this can reach your home. They can be mobile ambulances. TrueNet machine can be taken to your place and testing can be done. No one has to come out. So even future evidence like COVID and all will not really hamper your system. So idea is, if we really want to end TB by 2025, the mantra is that apart from the government apparatus, we put coalition of local governments, we put community engagement along with it, we take everyone along, including the political representatives at every level, the parliamentarians, the MLAs, the corporators, and even sarpanches. Everyone has to join hands. India is a huge country. Government alone, how much can the government do? You cannot expect government to work 23 hours in a day. They're also human beings. It's a gigantic effort, and we have taken a commitment. We'll end by 2025. We have the technical know-how. We are supplying vaccines to half the world today. Okay, we have the technical know-how. India even now manufactures enough medicine to supply to Brazil, South Africa, Russia. We send the TB medicines. Our pharmaceutical companies. So what is stopping us? We have the will, we have the money, we have the know-how. We need to put our partnerships together. We put our coalitions together, and we all have to make a strong concerted endeavor as one unit. Then only we will end TB by 2025. And we have to engage the private sector very productively. We have to find ways and means of engaging them. Whatever method we have tried, from Patna we began, I talked to local doctors. I said, we can give you 300 rupees, not more than that. They said, yes, we also willing to serve the people. Then we identified pharmacies, local pharmacies. Okay, we worked out a voucher system by which the pharmacies will be paid directly by the government. So mantra is, Let government pay for all the drugs for everyone in this country. There is nothing known as private sector, public sector. It is one India. TB is a common problem. It has plagued us for thousands of years. Let us get rid of this TB. And only way to get rid of this TB is that we are all cutting across the board. We all one India, one Indians. We are all suffering this disease. Our endeavor has to be one concerted endeavor together by working out a larger strategic alliance across the board.
Dr. Raghuram, sir, do we have confirmatory testing kit in today's date? If I talk about earlier, there was no confirmatory testing. Do we have confirmatory tests, and what are those tests?
Yeah. So thanks, Shalini. The confirmatory tests which you're talking of are advanced, molecular diagnostics that they are called. So there are two types of machines. One is, a gene expert, which is an imported machine, which was there earlier when we started off first introduction into the country, which Dr. DALBIR was referring to, a few years back. Now we also have indigenously developed, TrueNat machine, which is again a molecular diagnostic technology. So we have now invested in terms of making it available, across the country, and we have more than 3,000 machines across the length and breadth of this country, covering every district in this country. And these machines are platform technologies. So which means that, only the consumables change. The chip or the cartridge that is used in that changes based on diseases. So we use this in COVID testing also. Initially, when the COVID pandemic came in and testing laboratories for COVID were limited, all the TB laboratories were also used for COVID testing because of the availability of these machines. So this technology is now made available, although it is a little costly. It's not that it's a cheap one. The traditional technology that the system was using for diagnosing TB was sputum microscopy, taking the sputum, putting some reagents to it and looking at in a microscope to actually see the bacteria. That is how the confirmation was done. But there is, it had its limitations as a technology, and we were missing half of the cases. Even if very small numbers of bacteria are present over there, we are not able to see with that technology. But with these molecular diagnostics, we are able to catch 99.99% of the bacteria which is there in a sample which is getting tested. So these are very highly sensitive and advanced technologies, and these are now available across the country. So we have testing almost 60% of our patients were diagnosed based on those molecular testings, last year. So a lot number, more than 30-40 lakh tests have been done with that last year.
So these are the confirmatory tests, right, sir?
These are the confirmatory
tests.
Yeah.
These tests are available in private hospitals and labs also?
These are available in the private sector also and in the government sector, and it is available free of cost. And even for patients who are there, if they are there, even if they are seeking care in the private sector, the sample from there also can be collected, transported to these laboratories and tested over here. So it's basically making these technologies available free of cost. Even if the patient is seeking care, we don't differentiate between public sector and private sector for TB patients. So even the diagnostics and the drugs are available free of cost for the patients across both sectors in the country.
Dr. Vijay, sir, can TB occur again? If somebody gets treatment, then again he or she might suffer from tuberculosis.
Thank you, Shalini, for the question. See, it is said that if somebody has never developed tuberculosis, the overall chances of getting tuberculosis is 1% in the whole life. But once patient has developed tuberculosis, then chances of recurrence is a little bit higher in that patient. Reason can be multiple. One thing is there may, because we are constantly exposed to tuberculosis pathogen or the mycobacteria in the environment, so we can get reinfection. The another problem is sometimes after treatment, although we have treated the patient fully, but there may be some dormant kind of mycobacteria which stays in the body, and with the passing of time and because of certain regions, if our immunity goes down, then that dormant bacilli can reactivate. So either they can be reinfected or there may be reactivation. So yes, once patient have developed tuberculosis, it's not like he is 100% cured and there will be no chances of tuberculosis in the future. Despite best of treatment, best of investigation used before stopping treatment that you are cured, still there are chances that patient can develop tuberculosis in future.
Thank you so much, Dr. Dalbir, Dr. Raghuram Roy, and Dr. Vijay Hadda for joining us on Medically Speaking, because tuberculosis is a very important topic which we are going to discuss in future also. Thank you so much, sir.
Thank you, Shalini.
Thank you, Shalini. Thank you.
Thank you so much.